I'm Dr. Vashisht Dikshit, a board-certified plastic surgeon and one of the founding partners at Sculpta Aesthetics. Today, I want to talk about body contouring. In recent years, there has been a growing trend towards achieving a fit and toned physique. People are also more open about aesthetic medicine and surgery and are ready to explore these options to help them achieve their goals. Non-surgical body contouring is quite popular, mainly because of the increased effectiveness of new technologies as well as the minimal downtime associated with them. However, with so many options available, it's easy to get lost in it all and get confused. So, with this video, I aim to dispel some myths, talk more in detail about the various options that are available to us and what might work best for you. So let's dive in. Let's start with the basics then. What exactly is body contouring? So body contouring is a group of procedures aimed at refining the natural contours of the body. So these treatments target stubborn fat deposits, they tighten skin and improve the overall aesthetics of the body. These can be achieved surgically via procedures like liposuction, tummy tucks, arm and thigh lifts, or non-surgically using a variety of techniques that I will discuss later in this video. Next, what are the different techniques that are used? Now, all these different techniques have the same basic underlying principle. However, the technologies that they use are what differentiates them from one another. Beginning with cryolipolysis or fat freezing. So this uses controlled cooling to destroy fat cells and the body naturally eliminates it later. Next we have radiofrequency. So radiofrequency energy is used to gently heat and destroy the fat cells. The added advantage with radiofrequency energy is that it also stimulates collagen production, which helps with skin tightening. Next we have ultrasound therapy or high intensity focused ultrasound. This uses focused ultrasound waves to, you guessed it, generate heat and destroy fat cells, which the body then naturally eliminates. We also have laser technologies, which is used again to heat and destroy fat cells. And finally, we have injections, which use injections of deoxycholic acid. However, these are more effective for small areas, mainly the double chin, and they're not really very effective when used in large areas. One of the favorite first questions for most patients, especially those from India, is, Doc, how much is it going to cost me? Now, this varies greatly depending on where you're getting it done, what treatment is being used, how many sessions you're going to require. On average, they can vary between, say, around 3,000 per session up to around 15,000 or 20,000 per session. However, it's best to see a doctor, get a proper consultation and an estimate depending on what exactly is going to help you achieve your goals. The next question I usually get asked is, what can I expect during a session? Is it going to be painful? And how many sessions am I going to end up needing? So usually most patients complain of mild tingling, a little bit of cold sensation, maybe a little heat and discomfort depending on which technique is being used. However, there is no real downtime and majority of patients are comfortable throughout. Typically, each session will last around half an hour to an hour depending on which areas are being targeted. And usually we see optimal results between 4 to 6 sessions. Next is a question I have been very commonly asked by my patients. Doc, am I the right candidate for this procedure? Is it going to work for me? Now, the ideal candidate for non-surgical body contouring is someone who is just a little above their ideal body weight, maybe with a few stubborn pockets of fat which are resistant to diet and exercise. You have to remember, non-surgical body contouring is not a weight loss technique. It is meant to just contour your body, improve the overall aesthetics. However, most patients can benefit from non-surgical body contouring, but you'd have to consult your doctor to see if you're the right fit. The next common question is, can these treatments be combined with others? Certainly yes. Non-surgical body contouring can help to enhance results that are obtained after body contouring surgeries like liposuction, tummy tucks, arm lifts, thigh lifts, etc. Discussing these combination options with your surgeon will help you plan out your treatment journey, will help you tailor a plan specific for you, which can help you achieve your goals in the best possible way. The next aspect is safety and side effects. This is something that patients typically always want to know. Whether there are going to be any side effects, whether there are any potential complications. Now, when these procedures are done by qualified professionals for the right reasons, you can expect little to no side effects. Common side effects include some numbness, a little redness, or little swelling and discomfort in the area, but these resolve very quickly. However, one potential complication that is associated with fat freezing is something called paradoxical adipose hyperplasia, or PAH for short. What happens in such cases is instead of shrinking, the fat cells typically enlarge in some areas, and this is a little difficult to treat, but it certainly can be managed. What's important is that you discuss all the possible complications and potential complications of any procedure before heading into them. Moving to the most important question, well, at least according to me, how do you choose the right doctor? How do you avoid getting ripped off or fooled? Unfortunately, this problem is becoming a little too common nowadays. So you need to do your homework really well. Choose a qualified board-certified doctor. That's the first step. Check if they have any certifications in aesthetic medicine or surgery. You need to get a thorough consultation before you start any procedure. You need to discuss your ideas, your goals, your expectation, and you need to be comfortable and feel like you're safe. It might cost you a little more money, however, you're ensured of safety and you're ensured of reliable results. Now, what about post-treatment care? Is there any downtime? How soon are you going to be able to see the results? Now, most of these procedures don't have any associated downtime. You're going to be back to your routine immediately after the procedure. There could be some temporary numbness or redness, maybe a little swelling, but these resolve very quickly and they don't really get in your way. The results take a little while longer. Usually, initial results are seen a few weeks after your procedure, with your final results visible between 3 to 6 months after your procedure. This is the amount of time it takes your body to process and eliminate all the dead fat cells. Maintaining a healthy diet, keeping yourself hydrated is key to ensuring good results. Are these treatments any effective? Are they as effective as surgery perhaps? Now, effectiveness or how happy you are is definitely going to vary from individual to individual and what treatment you get. Many patients experience optimal results after multiple sessions. Now, when it comes to surgery is definitely a more radical option. However, you have to consider the risks that are associated with surgery. So to tie it all up together in a neat little bow, non-surgical body contouring is a viable option for people who want to refine their physique without going in for surgery. However, consulting with a qualified professional is absolutely crucial in tailoring a plan that is specific for you to help you achieve your goals. Do your homework well, choose a qualified professional, avoid getting scammed. Thanks.